Hi, my name is Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida College of Public Health. And I recently did an interview with WLRN, the South Florida NPR affiliate radio station. And in the interview, I was talking about the transition in the Florida Department of Health's reporting from daily and releasing a lot of publicly available data sets to a weekly reporting structure. And one of the things I had said in the piece is that I had been investigating other ways in which I can get access to the same kind of information that was made available by the Department of Health on a daily basis. And I've been getting just a ton of questions about that. Where do I go for this information? Even though I said, we can sometimes obsess about the daily ebb and flow of these various COVID-19 metrics, and that what I really feel is important are the underlying trends, which we usually use weekly or biweekly rolling averages. And so again, though, for people who want to get granular information, I thought I'd take the opportunity to walk you through. This is certainly not comprehensive, but this is maybe a 10,000 foot view of what's available on the federal websites to help you to track daily COVID-19 numbers. And so let's start simply with cases, testing, and positivity. So again, when you go to the CDC's COVID-19 tracker webpage, if you just start with the cases, death, and testing area, you immediately get some queryable information. So for example, the default pop-up is a state level map, and it gives you the number of cases in the last 7 days as a count. But you can of course request cases in the last 7 days, cases since the beginning of the pandemic. You can do counts, rates, and it's not just information that they provide you when you hover over, let's say, the state. You just get this window. There is certainly information that you can dive a little bit deeper and download the underlying data. Here's just a good example. If from that page you go down towards the bottom and you click on View Historic Case and Death Data, it takes you to this web page from the CDC. You can export the data to a CSV format, and ultimately you get this kind of granular information. I've just filtered to Florida. You get now daily information on cumulative cases, new cases reported, new deaths reported, cumulative deaths. So you still get that daily information on these metrics that are reported daily. Now, I need to say this almost throughout the entire video. A lot of people want to do comparisons. And so if you were to compare what I just showed you, this downloadable data set that, let's just say, focus on cases on a daily basis, if you compared that to the Department of Health's new weekly report and you aggregated to the week level, you will not get the exact same numbers. It's not a caution for concern, it's differences in the way that these numbers are pulled. So CDC is pulling information based on when things are reported, but of course we know there can be a reporting lag. The Department of Health, when they pull their numbers, is based on when a person tested positive. So again, the numbers will be very, very similar, but they will not be exact. And even on my old dashboard, you can see down at the bottom, I used to show the two epidemic curves, one based on when cases were reported, the other based on when a person first tested positive. And again, the shapes of those curves are very, very similar, but the actual numbers on each day are slightly off. So do not expect the numbers to be perfectly accurate. And if you find that they are not perfectly accurate, it really is not cause for concern. The next thing that you might want to drill down to, again, if you're still clicking on the same page and you click on percent positive, again, you can get the positivity range in the past 7 days, in the past 30 days, or over the entire course of the pandemic. You can even compare to other states. If you wanted very granular information at the state level, you can again go to this COVID-19 community profile report. You can download the spreadsheet or the PDF format. And again, you can see here, this is state level information on percent positivity. And it's not only overall and testing volume, they also give you positivity rates by age groups for those states that report it. So again, a lot of granular information, and even though the information provided on this report usually covers a 7-day window, you can download this report almost daily. So, again, getting a sense of if you wanted to track the change in the daily numbers, this affords you the opportunity to continue doing so. And again, I'll say it over and over in this video. Do not expect, if you now compare the positivity on the Department of Health's weekly report, do not expect it to match exactly what you're seeing on the report that I just showed you. There are, again, good reasons for this. The Department of Health, when they produce these weekly reports, they're able to unduplicate at the person level. What I mean by that is if a person was tested, let's say 3 or 4 times during the week for their job, the Department of Health can deduplicate that and count each person only once when they report the weekly positivity rate. The Department of Health includes both PCR and antigen viral tests in their calculations, whereas, the graphic that I just showed you here, this community profile report, it's only on PCR testing. So again, you're going to see slight differences in the numbers, but it's not because somebody's reporting wrong information. Sometimes there are differences in underlying case definitions. Sometimes these standardized case definitions are made by entities like CDC or the Department of Health and Human Services to keep a standard definition across all states. And so again, the numbers will be similar, but they may not be exact. And again, this is just an old shot from my old dashboard where I would show the difference in the positivity as measured daily and looking at the trends that way versus the dots, which are this weekly report, which they're able to deduplicate. So again, they will show you the same underlying trends, but the numbers won't be exact. Here's just another area of the CDC COVID-19 tracker. Again, from the daily and total trends area. It's kind of cool because you can actually overlap different metrics that you want. So in this case, I'm showing the epidemic curve, the number of cases reported on each day, the 7-day trends in that, and then I'm overlaying the positivity rate. You could overlay the mortality rate per capita. You can overlay the cumulative number of deaths over time. So this gives you an option to kind of interact with the visualizations and produce a few customized reports, not only for Florida, but for any state. And then, of course, something that people inherently want to do is compare trends across states and regions. And so, again, the CDC COVID tracker allows you to do that. What's in the green here is the traditional epidemic curve that for those people who have been tracking Florida, we see the summer surge, the winter surge, the little blip we had in the past couple of months, and then the decline that we've had of late. You can compare that. In this case, I'm comparing in the purple to California and in the blue to Texas. You can pick up to, I believe, 6 different states that you can compare a lot of different metrics. It doesn't have to be new cases per capita. It can be mortality rates per capita, actual number of cases, whatever you want. So again, it offers you a lot of customizability. What about current hospitalizations? I got a lot of feedback that, ACA is no longer reporting the information. And the other thing I would get is, why isn't this on the Department of Health's weekly report? And I would just point you to the fact that the Department of Health really never reported on current hospitalizations. That was something that was queryable through ACA or the Agency for Healthcare Administration. And so actually for the past couple of months, I had already steered away from what ACA was reporting because the feds were able to take what Florida was reporting to them and report even more granular information. So I'm going to walk you through that briefly. First of all, current hospitalizations. How many people are sitting in a hospital right now with COVID-19? Again, this is from the menu for the COVID-19 tracker. You go under healthcare settings, look under hospitalized patients. You can then click on the drop down to restrict to Florida. And this is, again, if you had been to my dashboard and what ACA was reporting, this is very, very similar to those numbers. And so you can see, again, this was associated with the summer surge, then the winter surge, and then we've been on a pretty big decline, thankfully, largely due to vaccination rates increasing over time. But again, you can hover over this, you can get daily numbers, and there are even downloadable data sets behind the scenes that enables me to do this. So this is my dashboard. I download the data sets on my own, and I present to you basically the same thing that you saw on that previous graph as in the dark blue, but then I also overlay the suspected. So there's the confirmed COVID-19 current hospitalizations as well as those that are suspected. And so I've also added that. And again, you can query down at the state level. You can change the date range. So these data sets are downloadable and again, give you daily values of currently hospitalized patients. What about something that ACA did not report on, but you would get on maybe a few county level dashboards in Florida? New hospital admissions. And so, who's coming into the hospital as a new admission? And so, again, instead of hospitalized patients, now we click on new hospital admissions, and the process is pretty much the same. I just picked Florida here. You can get the overall age distribution of new admissions, and then you can get it stratified by age group, which is outstanding because obviously the message is not the same for all age groups. The absolute risk of being hospitalized is different for different age groups, and the trends due to vaccination rates have been different. And so, again, not only do you get this queryable system online that gives you some good global information on the left here, what are the recent changes, but you can download these data sets. And this is, again, now from my dashboard. This looks very similar to what you just saw. This gives you age-specific trends. And so, again, on my dashboard, you can hover over any data point and get exactly how many admissions occurred on any date, as well as the rate per capita. So, again, very granular information still provided at the daily level. Let's shift over to deaths. Deaths, again, you can go and in this compare trends across states and regions, you can compare the actual, you can see up here on the queryable list. I'm looking at cumulative deaths, the raw totals over time. That's what's on the right here. Again, comparing different states on their cumulative deaths over time, or we could look at actual deaths that are being reported on a daily basis and comparing different states. So again, this information is still provided on a daily basis. If you actually wanted even more granular data, that community profile report that I alluded to earlier, again, you can download this and you can see here they have deaths in the last 7 days by state. They have deaths per capita in the last 7 days. So again, you can still get very granular information. They do aggregate this to the week level, but again, you can download this report. I think it's offered 6 or at least 5 out of every 7 days. And so you can still look at how the cumulative numbers change over time and get a good daily estimate. Okay, transition to vaccinations. That's something that obviously we all want to pay very close attention to. Again, if you go to the CDC's tracker and now focus on the vaccinations menu and just look at the big broad vaccinations in the United States, you got a lot of good just general information on what's happening at the country level. And then you can see at this menu down at the bottom, you can drill down to focusing on total doses administered, people vaccinated, and then you can focus on the pure count or the rate per capita, which I always prefer. And then you can even assess this in different denominators. So do we want to know the proportion of the entire population in each state that has been vaccinated? The proportion of those of a vaccine eligible age, 12 years of age or older? What about just among adults or about, among seniors? You can drill down to all of these on the tracker. And if you click, so below all of that information that I just showed you, you can click on a box that says View Historic Vaccination Data. And again, I don't intend for you to be able to read this, but it's a downloadable data set. It's got one observation per state or jurisdiction. And what I've highlighted here is, again, the percentages of the populations that are vaccinated with one dose, that are fully vaccinated, using all of these different denominators. Very granular information that you can download on a daily basis. You can even get access to this data set, so be mindful of the title here, COVID-19 vaccinations in the United States by jurisdiction. If you export this, again, download this file, now you don't just get one record per state, you now get one record per state per day. So this is now that time series data set. I filtered to Florida. I've gone from most current to least current, and we can now see not only how number of people vaccinated have changed every day, but how those percentages have changed every day, and use this to make projections. So if we maintain the same rate of vaccinating new people as we have in the past 2 weeks, when will we hit 70% of all adults vaccinated? Those kind of things you can very easily answer by downloading these data sets. Notice again, the granularity is at the level of the day, so we are getting daily information. The one thing that we don't, in my opinion, have quite as granular information on is racial ethnic disparities in vaccination rates, which is hugely important. The CDC, if you click on vaccination demographics trends, you do get information, but this is at the level of the United States. There is, if you click on View Historic Vaccination Data, there is some COVID-19 vaccination demographics. And sorry, but again, it doesn't get you a lot of granularity. We used to be provided with vaccination data at the level of the county, and then within each county, you would get some information on race and ethnicity. Even though there was a lot of missingness to those data elements, it was still some useful information. I have yet to find that detailed of information being provided at the CDC. What about, so I've been talking about a lot of state level stuff. What about county level granularity? That's something that we used to be afforded with some of the DOH reports. Now we still get some county level granularity, but it's at the weekly level. So what about daily level information at the county level? What's really cool is in this section of their menu, when you click on your community and then county view, you can pick any county you want. I picked the one in which I always want to say I live. This is where I actually was born and raised, is in Hillsborough County. I live just north of the border now in Pasco County, but I picked Hillsborough County because that's always going to be home to me. And you can see, you can pick from a lot of different things: level of community transmission, cases, deaths, hospital utilization, all of the things we've been talking about. Now you can get it at the county level. And so when you start to scroll down, you first get some detailed information on vaccinations, specifically in Hillsborough County. Again, number of people, percentages of the population, most of the information that you'd want to know. And then again, you can scroll down even further, download data sets that provide you now with all of the counties in Florida, and you can get numbers and percentages of the population that are fully vaccinated. And again, you can download this information on a daily basis and see how these numbers change over time. So this is now daily information provided at the county level for vaccinations. If you scroll down a little bit more, now you're getting, again, this is specific to a county, Hillsborough County. There's a slider up here that I've kind of hidden that you can change the time frame that you're looking at, but now you can get cases. What is happening over time with cases in Hillsborough County, and what is the most recent change? Deaths are often suppressed at the county level because we don't see enough. So that's why you see this less than 10. They are concerned about confidentiality, and so sometimes death information gets suppressed. You get percent positivity at the county level, and again, what's been happening recently: testing volume, new hospital admissions, the percentage of beds used by COVID patients, all of that stuff you can get granular information. And at the bottom right here, you see this county level time series data. So now for Hillsborough County, by day, I can get the number of cases, the confirmed deaths, as well as much more granular information. This is again another example of one of those data sets that I can download at the county level, and I can get case counts in the past 7 days, the rate of those cases, some testing information. So again, a lot of this information ultimately does become available in electronic spreadsheets on the daily basis. And again, this is another one where, let's just say you wanted to focus on what about the number of current hospitalizations and new hospital admissions in the past 7 days by day. So the rolling 7-day average of currently hospitalized patients, which is what ACA used to give us, as well as new hospital admissions on average at the county level. So again, you're getting that information right here. You can also get it if you wanted to look elsewhere, that community profile report that I was talking about. On the left, you can get testing information at the level of the state, but they also have a county level tab where you can still get positivity. Again, this is refreshed 5 to 6 days every week. It's usually based on a week's time period. And again, you can get that granular information on positivity rates at the county level. I've just filtered to counties in Florida here. What about some other things like genomic sequencing, variants, even mitigation? That's some cool things that I found on the CDC data tracker as well. Again, I won't belabor this because the information is not that granular when you get to cases sequenced, but you can actually look. We've apparently sequenced over 38,000 cases in Florida, which represents 1.68% of all cases. And you can look at that across all states and even download down here the information into an Excel spreadsheet. Another thing that I just found interesting is mitigation efforts. So if you wanted to focus on things like restaurant closures, mask mandates, gathering bans, and how that's evolved over time, differences by states, you can get that information also from the CDC COVID-19 tracker. But the big thing that we did lose is this Caseline file, one record per person who's ever tested positive in Florida. It would have all kinds of additional information like single year of age, county of residence, gender, the date that they tested positive, all kinds of good information. And that's really why I ultimately thought that my dashboard was useful to people, is because you could drill down into the data. You could ask, for example, in Hillsborough County in the past 8 weeks, among people age 5 to 17 years old, what's been happening with various trends. And so, again, this is what that looked like on my dashboard. You could click on a lot of these things. If a reporter was looking for a 10 county catchment area and wanted to know what was happening with the younger working age population from 19 years of age to 64 years of age. And again, you just had a lot of granularity. You could hover over a data point and get a lot of very detailed information. That kind of drill down capability we are losing with the absence of the Caseline file. Another one that I used to produce with the 68-page daily vaccination report that was at the county level, that also provided us with age information. I was able to give very granular age-specific and county-specific vaccination rates. I've already mentioned that you can still get a lot of granularity at the county level, even by age. It's just not in these 10-year age groups. It's in a little bit broader age categories. So we can still track this information, but maybe not quite to the same granularity. It is absolutely information that is available, and I'm certain that is being used by county health departments in the state to try and combat problems with vaccination rates. But again, I'm talking about what can be accessed and what is publicly available. And then I put a big question mark on here because in my head I was trying to investigate, well, where might we be losing some more granularity in data? So just quickly, and again, I apologize, this is not very polished, but another thing that a lot of people used to look at is information on cases in primary and secondary schools and staff and teachers and students by facility. And again, this report is no longer being produced, but I used to myself go to county-specific dashboards to access this information on a timely basis. This is just one example of, I think this is Alachua County that I pulled, same kind of information that we're still able to get at least from a lot of the larger school districts. If you were interested in positivity rates specific to the pediatric population, again, I know a lot of people paid attention to this. This same exact kind of information at this granularity, I've not seen available. Again, you can still get daily testing information at the county level. You can still get some age-specific county testing data, but not to this granularity. This image on the right, I'll get back to in just a second. In fact, right now, one of the things that I know a lot of people rightfully paid attention to is a report that would come out. Usually it was on a daily basis, although it would really ebb and flow as to when this was released. But it is long-term care facility data, and specific to the level of the facility. You would get the number of positive residents, the number of positive staff, and so this was really meaningful information. And initially, I thought we were going to lose a lot of granularity on that, because the CDC's COVID tracker does track this information. This is on resident cases, this is on staff cases, and you can filter down to Florida. And so you can still track this, and you can see, obviously, the vaccinations have just done wonders for what's been happening among residents in nursing homes and other long-term care facilities, but you couldn't drill down deeper. People wanted to know at the facility level. Well, lo and behold, a little bit of digging, that is absolutely available to way more granularity than we've ever had, that I've ever seen. And so this is where that landing spot is on data.cms.gov. Ultimately, this will lead you to a data set called the COVID-19 Nursing Home Data Set. You can export this information and get a very, very large, I think it's a CSV file that you end up downloading, and I know you can't see it, but what is at the bottom here is basically you can drill down to the facility level, get weekly data on new cases, new deaths, all kinds of information. Again, way more granular and specific of information than I would have even gotten from that PDF report. And again, what's cool is it's in an Excel or a CSV format, so it's very easy to then upload into visualizations or make better use of the data. So this was something that I had not explored, but that I was really happy to see existed. And then again, so many other things I'm not able to dive into that are available through the CDC COVID-19 tracker. This is just information on correctional facilities, which obviously in Florida very early on, we were getting granular data at the level of the correctional facility. For some time now, we've gotten more aggregated numbers. And again, I think it's a similar way now. It's more aggregated information on what's going on in this very vulnerable population. And then even if you wanted to look at trends in emergency department visits, this is, restricting to Florida, looking at the 7-day moving average, and it's the percentage of emergency department visits with diagnosed COVID-19. And so this very much seems to mirror what's happening with COVID-19 hospitalizations, as you would expect. But again, all of this information available at the daily, basis, and you can track that information pretty well. So I think that's it. 25 minutes. I apologize, but this is something that I needed to address. This is obviously not comprehensive, but at least for a lot of the data elements that maybe you used to get in a PDF or an electronic format, these are just some of the ways in which you can still access that information. And so that's all I've got for you. Hope everybody's doing well, and I'll talk to you soon.